I am Dr. Sridhar here. Most of us would have come across recent articles in newspapers, websites, as well as medical journals looking at the effect or possible link of paracetamol taken by the pregnant mothers or pregnant women to autistic spectrum or ADHD-like disorders in the newborn. Is there a possible link? How do we decipher and how do we manage issues that need paracetamol or similar medications in the pregnant woman if we are worried about it? So paracetamol works by inhibition of prostaglandin production, and the possible mechanisms can be through effect on endocannabinoid receptors in the brain or through the impact of prostaglandin on the developing brain itself. The more plausible reason is obviously the reason why the mother is taking paracetamol can be an indication, like fever can be associated with problems or infections can be associated with problems in the developing brain as well. So we have two situations where paracetamol is often used in pregnancy. It's for pain relief where the mother has body aches or flu-like illness and fever. So fever, as we know, if it's a high-grade fever, can cause problems to the baby in the fetus. And pain relief, obviously, paracetamol has been shown earlier to be the safer options compared to brufen or diclofenac and so on, the NSAID medication. So what do we do now? So the first thing is, it's not a proven hypothesis. There can be an association which can be direct or indirect. There is no need to panic, but at the same time it makes sense to look at situations where paracetamol is essential and restricts its use only to situations where it is needed in restricted doses as well. For example, most over-the-counter flu medications have paracetamol and the patients take it whether they have fever or not. The body pain associated with flu can be improved with just better hydration and rest. You don't need medication to treat it. Similarly, for aches and pains, we have simple counter-irritant applications and massage and so on. You can manage them without use of medication. So if the pain is severe, or if you have high-grade fever where paracetamol is essential, take the dose at the time when the treatment is needed. Don't take it as a course, don't keep repeated doses. So minimize exposure. There are also certain periods of gestation when the brain development is happening rapidly. For example, the first 4 to 12 weeks is a critical time. So during that period, try your best to avoid the medication. However, if you do need it, restrict it to 1 or 2 doses or as needed and discuss with your doctor as well. So the simple message is, whether there is a real connection or not, it makes sense to be careful in the use of medications, especially medications where there could be a suspected effect. So use paracetamol where it is absolutely essential and in limited doses, not as a course, but just 1 or 2 doses at a time as needed. I hope this helps.